Welcome to the deep dive. Today, we're tackling a really interesting, slightly different approach to pain relief.
Yeah, it's not just about pills.
Exactly. Forget just, dulling the ache. We're going to explore a method that tries to get right to the heart of the problem using targeted massage.
Mm-hmm.
And our main source for this is a paper, Pain Relief by Targeted Massage, by Dr. Lev Nemotin. We'll dig into the science behind it.
Right. Because, let's face it, so many of us rely on medication. And, well, they help, sure, but they often don't fix the underlying issue, do they?
No, it's like you said, silencing the alarm but not checking the engine.
Precisely. So this deep dive offers you, the listener, a chance to understand Dr. Nemotin's alternative view. Maybe a more fundamental way to get relief.
Okay, let's talk about Dr. Nemotin himself. His background is pretty fascinating. He's got a PhD in mechanical engineering from Kazakh State University.
So straight away, he understands physical systems mechanics.
Definitely. But his career path is really varied. He worked on nuclear reactor safety at Brookhaven National Lab.
Wow, okay. High-stakes stuff.
Talk about needing precision. But more recently, he's been focused on fitness and health equipment. He's the CEO of N5 Digital, Inc.
Ah, so a shift towards the body.
Yes. And importantly for this topic, he's actually a developer of the IsoTone device. It's a resistance fitness and physical therapy device. It's currently in testing and marketing phases, apparently.
Okay, so that device ties directly into this research then.
It seems so. This mix of serious engineering and, health tech gives him a pretty unique perspective on something like pain, doesn't it?
That interdisciplinary angle is probably key here. Looking at the body, not just biologically, but also mechanically.
Applying engineering principles, maybe?
Could be. Thinking about forces, stresses, responses.
Yeah.
Maybe his reactor safety work influences how he sees the body's complex systems.
Interesting thought. So, our mission today for this deep dive, let's really understand the principles behind this targeted massage idea from Dr. Nemotin. We'll look at the IsoTone device's role in his testing and, crucially, get into the why. What's the scientific rationale suggesting this could actually work?
Exactly. Not just the what, but the why. That's where the real understanding comes in.
Okay, let's kick things off with the problem Dr. Nemotin is addressing. He really highlights how our usual go-to for pain is medication that mostly just blocks our perception of it.
Yeah, it stops the signal getting through or dulls how the brain interprets it.
But the underlying issue might still be there.
That's the point he makes. I mean, the meds can be a lifesaver for functioning, no doubt. But the inflammation, the nerve irritation, the actual tissue damage, that might not be getting resolved.
Right. So that's the setup for his alternative, this targeted massage technique. What's the core idea? What does it actually involve?
It's actually pretty straightforward on the surface. It involves localized massage, guided by the patient themselves.
Patient guided, okay.
Applied right on or very near the pain spot. And the key detail is the frequency around 5 hertz.
5 hertz? What does that feel like? Like 5 vibrations a second?
Roughly, yeah. Like 5 little back and forth movements or pressure pulses every second. Not super fast, not super slow.
And that patient-guided part feels important?
Oh, absolutely crucial. Dr. Nemotin really stresses this. You, the person feeling the pain, know exactly where it's worst, right? And what pressure feels helpful versus painful.
Yeah, nobody else can know that quite the same way.
Exactly. So it's not passive. You're actively involved, adjusting the location, the speed, the duration, how hard you press, all based on your real-time feedback. It makes it incredibly personal.
So you're constantly fine-tuning it as you go.
You got it.
And it's not like one big, long massage session fixes everything. I think the paper mentioned something about frequency.
That's right. He suggests that for more lasting relief, doing several short sessions throughout the day might actually be better than one long one.
Interesting. Why is that, do you think?
Well, the idea might be like providing consistent, gentle nudges to the body's healing processes, rather than one overwhelming push, keeping that stimulation going periodically.
Okay, that makes intuitive sense. Now, let's bring in the IsoTone device you mentioned he developed. The paper talks about using it in testing. What is it?
So the IsoTone, based on the description, seems designed to be particularly useful for this kind of massage. It has these ergonomic sort of ball-shaped handles.
For grip?
Good grip, yeah. And also for precise movements, apparently. And it's designed as a dual-mode thing. You can use it for resistance strength training.
Oh.
But also specifically for this therapeutic massage we're discussing.
So it's not just a lump of plastic. It has some features.
Definitely. It apparently has auto-adjusting resistance, which is interesting.
How so?
It means you can control the intensity just by how much force you apply, Press harder, more resistance, ease off, less resistance, makes that patient-guided aspect quite direct.
I see. And feedback.
Yes, it even mentions a gauge giving real-time feedback.
Yeah.
So you can kind of see how your muscles are engaging or, monitor the session's effectiveness somehow.
That does sound pretty tailored to this method. How would you actually use it for the massage part?
It seems versatile. It has a main cylindrical body, which you could probably use for broader strokes on larger areas, like a thigh or back.
Right.
But then those rounded handles, the spheres, they'd be ideal for really zeroing in on a specific knot or trigger point, pinpoint pressure.
And this seems important. The paper is clear that you don't need the IsoTone, right? The method itself is the key thing.
Absolutely. That's a critical point they make. While IsoTone was used in their research and clearly has helpful features, the principle is the main takeaway.
So the targeted massage, the 5 hertz, the patient guidance.
Exactly. You could potentially achieve that with another tool, or maybe even just your own hands or fingers, provided you can maintain the grip, control the pressure, and keep up that rhythm.
Okay, got it. The tool facilitates, but doesn't define the method itself. Right. Let's shift gears to the really fascinating bit, the why. What are the proposed mechanisms? How does Dr. Nemotin suggest this actually works to relieve pain?
He focuses on 2 main systems being influenced here. First, your circulatory and lymphatic systems.
Okay, blood flow and waste removal.
Basically, yes. He explains that areas in pain often suffer from poor microcirculation. Tiny blood vessels aren't working efficiently.
Meaning less good stuff gets in and less bad stuff gets out.
You nailed it. Fewer nutrients, less oxygen delivered to the tissues. And waste products, things like inflammatory chemicals, they tend to just hang around and build up.
Which probably makes the pain worse or keeps it going.
Very likely. So the massage, specifically at that 5 hertz rhythm, acts almost like a mechanical pump.
Pushing things along.
Yeah, the rhythmic pressure physically helps increase blood flow into the area, and it also stimulates the lymphatic system, that's your body's waste drainage network, to work better and clear things out.
So the benefits are?
Well, better blood flow means faster delivery of nutrients and oxygen needed for tissue repair. It means immune cells can get in there more effectively to deal with inflammation. And better lymphatic drainage means flushing away those metabolic wastes and inflammatory byproducts that can irritate nerves.
Okay, that's the physical plumbing side. Makes a lot of sense. What about the other system he mentions? The neural part.
Yes. This is where it gets into how we actually perceive pain. It's really intriguing.
That's complex, I imagine.
A bit, yeah. Dr. Nemotin points out that pain isn't always just a straightforward signal of current damage, especially with chronic pain or something like phantom limb pain.
Where there's no limb even there anymore.
Exactly.
Yeah.
In those cases, the nervous system itself can get kind of miscalibrated. The signaling pathways become hypersensitive, or they get stuck in a loop, constantly firing off pain signals, even when the original reason is gone or healed.
Like the nervous system has learned a bad habit.
That's a great analogy.
Yeah.
It's learned a pain pathway. So the targeted massage comes in here too, by repeatedly stimulating that specific area.
With that 5 hertz rhythm,
You're generating strong sensory signals, non-painful signals, ideally. These signals travel up the nerves towards the brain. They're called afferent signals.
okay.
And these strong, rhythmic sensory signals essentially compete with the pain signals for the nervous system's bandwidth, so to speak.
Like jamming the frequency.
Sort of, yeah. It relates to the idea of neural gating, the concept that non-painful input can close a gate in the spinal cord, blocking pain signals from reaching the brain as easily.
So you're distracting the nervous system in a way?
Partly distracting, but Dr. Nemotin suggests it might be more profound. He proposes this repetitive focused stimulation could actually help retrain the nervous system over time.
Retrain how?
By constantly sending this normal sensory information from the area, it's like hitting a neurological reset button. It reminds the nervous system what normal, non-painful input from that spot feels like.
Reprogramming the bad habit.
Exactly. Leading to potential neuroplastic changes. The brain and nerves can actually adapt and rewire themselves. In this case, the hope is they rewire to reduce the sensitivity, break that pain loop, and diminish that false perception of pain.
Wow. That sounds potentially huge for things like chronic nerve pain.
It really does. He specifically mentions potential benefits for conditions where standard meds often struggle, like neuropathic pain or that phantom limb pain we talked about.
Because the problem there is the nerve signaling itself, not necessarily ongoing tissue damage.
Precisely. So targeting the signaling directly makes a lot of sense.
Okay, this is definitely clicking. So pulling it all together, what's the big picture takeaway for you listening to this? Why should you care about this deep dive?
Well, connecting it back, what's really compelling is the potential here. We're talking about a possibly low-cost, non-drug approach. Something with likely minimal side effects compared to medications.
Yeah, that's appealing.
In a world where popping a pill is often the first step, this offers a different perspective, using mechanical stimulation to tap into the body's own healing and regulatory mechanisms.
It feels more active, more empowering, perhaps, putting control back with the person in pain.
I think so. Now, we absolutely have to add the caveat, which Dr. Nemotin also implies. This needs more rigorous science.
Right. This isn't a proven cure-all yet.
No. The principles make sense, the initial testing sounds promising, but we need proper, large-scale clinical trials to really validate how well it works for which specific types of pain and for different people. It's an evolving area.
Good point. So let's recap the core ideas from our deep dive. We've got targeted self-massage.
Potentially using a tool like IsoTone, but not necessarily.
Showing promise by tackling both circulation and lymphatic issues in the painful area.
Getting the plumbing working.
And by potentially helping to reset or retrain those faulty nerve signals causing the pain.
Right. Disrupting pain loops and promoting a return to normal sensation.
And the keys seem to be hitting the right spot, using that 5 hertz frequency, and most importantly, letting the patient's own feedback guide the pressure, speed, and duration.
You summed it up perfectly. It's a really holistic look at pain, considering both the tissue environment and the neural signaling.
This has been genuinely fascinating. It really gets you thinking about the body's own ability to sort itself out if given the right encouragement.
It does, doesn't it? And that actually leads to a final thought, something for you to maybe ponder on.
Okay.
Given that our bodies do have these inherent self-repair systems, and seeing how mechanical stimulation like this might influence pain, where else could we apply similar ideas?
You mean using targeted mechanical input or personalized feedback?
Yeah, could those approaches potentially help with other chronic conditions beyond just pain? What other systems might respond positively to this kind of directed physical intervention?
That is definitely food for thought. A whole other avenue to explore.
Something to mull over.
Well, thank you for exploring this topic with us today. It's been a really insightful deep dive.